It's lovely to be here, and it's a very pleasant surprise to see so many people obviously really interested in the topic tonight. I think it speaks to the importance of autism in the education space at the moment. And so what I thought would be useful for us to do today is to just go through some of our some information that we have collected up about what makes school work for kids on the autism spectrum. And I also want to talk to you about a model that we're developing at Griffith University, which pulls together a lot of good practice in education generally and in the education of students with autism. We've just actually, in the last couple of days, finalised a proposal to work with the education department here on rolling this model out across the state, which is very exciting for us. So I'll explain a bit about that to you, and also tell you a little bit about what we do here what we do here in Queensland, what we do at Griffith University at the Autism Centre. So before we start, I just would like to talk to you about some of the key themes. See if that's working. Yep, great. Key themes that inform our work, and I think these are not things that we have invented, but really it's a question of pulling together what we know is good practice as well. So I'll just quickly run through, because these will really inform what we talk about for the next little while, and it also informs our overall work and of course the courses that we teach and the research that we do. So first of all, we always aim to focus on the whole person, and the whole person in their context. So it's the whole person where they live, work, play, go to school, go to preschool, whatever age or stage that person is at. And also, of course, a key part of that context, that holistic approach, is the family of the child, and in many cases increasingly we're seeing families that have more than one child on the autism spectrum. So it's very much looking at the person in context and putting the person at the centre of everything that we do. The next key thing that we really emphasise is looking at a strengths-based approach, and this won't be novel to any of you, I'm sure, but for many, many years, historically, autism's been framed in a more pathological medical framework. In fact, it was, once it was identified in the 40s, it was described as a form of childhood schizophrenia. And those of you who know about the history of education and the history of education of diverse learners will know that children with autism, along with other children with special needs or disabilities, were considered to be ineducable for many decades. So right up through the 60s, these children were, the recommendations to families was usually to institutionalise the child, it's only really in the second, well, less than the second part of last century that we started to accept the idea or understand that these children could learn. And really that was probably the influence of behaviourism, which was developed as a theoretical framework in the 50s. So the idea that these children could learn, and the idea that these children could come into school and be educated. What we saw at that time was the setting up of autism-specific schools, special schools generally, some schools for children, just children with autism. And it was really not until the 80s and 90s that we saw the idea emerging that children could be educated together in an inclusive setting. There's a strange buzzing noise behind me. Something's going to blow up, is it? No? Good. I don't have any noise sensitivities, but I'm just telling you. The other thing that I think goes along with that idea that children can be educated in inclusive settings is the focus on difference and diversity compared to disability. So seeing, looking at the whole range of diverse learners and looking at valuing that diversity rather than seeing it always as a disability and always disabling. Along the lines there, we have a renewed focus on behaviour. Behaviour often comes up in schools as the first thing that people call, for example, call people like myself in because they've got problem behaviours, a child has problem behaviours. And we're really now encouraging people to think about the behaviour from the child's perspective as well as from the school's perspective, and talk about a behaviour of concern. You need to keep in mind that it may be quite functional for the child with autism, but obviously not for the school, so it may be described as an interfering behaviour. In terms of terminology, there have been some changes of late, and some of you may be aware of the fact that the diagnostic criteria for autism have been revised. The revision is not, it isn't as if people have come up with a completely different set of criteria for autism. It's really a question of regrouping those and just a renewed emphasis on social communication and an emphasis on repetitive behaviours and restricted interests. It is of interest to know that in the new version of DSM-5, which is the main diagnostic system used here in Australia, there is now the inclusion of sensory characteristics of autism as a criteria as well, although it's not a compulsory criteria. So you can have a diagnosis of autism spectrum disorder as per DSM-5 if you don't have sensory issues, but it is now recognised as a possible diagnostic criteria in the repetitive behaviour and restricted interests group. So we do think about the way that we talk about autism. Through this talk, I will use the term autism to encompass autism spectrum disorder as it's described in DSM-5 now, but also autism spectrum disorders as they are described in DSM-4, that's Asperger's, Rett syndrome, PDD-NOS, which is when you have a bit of autism but not enough for a full diagnosis, and childhood disintegrative disorder. Now, those have largely been dropped from DSM-5. We now recognise that Rett's and childhood disintegrative disorder are clearly genetically based and not necessarily the same thing as autism, although the behaviours associated do look a bit like autism, well, quite like autism. But what we're seeing now is also a recognition of the fact that it's been very difficult to establish in the research space a functional, reliable difference between Asperger's syndrome or Asperger's disorder and high-functioning autism. So the use of the one term autism spectrum disorder for both of those reflects that failure to differentiate. There has been a reaction, particularly from people on the autism spectrum who identify as having Asperger's, and I think the reality will be that term will continue to be used and continue to have some currency, but it's just not in the DSM-5 diagnostic criteria anymore. The other thing that we do focus on very much is putting the person first. We put, in everything we do, so we recommend the use of person-centred language, so it's a person with autism. Having said that, there are quite vocal people within the autism community who actually prefer to be called autistic or an autist, or there are a range of terms for that. And of course, very much recognise that, but I think as professionals working in the space, I think it's beholden on us to continue to ensure that we put the focus on personhood first and the autism second. The other thing I hope does inform our work is persistently remembering that we need to consider the perspective of people on the autism spectrum. Many times I've sat in conferences and listened to speakers, and I thought, if I was a person with autism, I would be feeling either really upset or really angry at this point in time because of the way people talk about people with autism, and I think can be quite disrespectful. So one of the things that I always try and remember, and I hope can recommend to you, is that we maintain always that thought of, the respect that we should give people who are, for whom life is difficult enough as it is, without having us adding to that. Okay, so having got that out of the way, the picture, by the way, is a very young Jim Sinclair, who's a man with autism who has written some very perceptive things about the condition. So he's making a very good point there about the importance of knowledge and understanding for all of us who are interacting with, working with autism. This, I think, really embodies the challenge for us as educators. These are the words of a student in a New South Wales high school, of course, not a Queensland one. And I think it really sums up the challenge for us in schools in terms of how we're best going to provide a program for these students that engages them and is meaningful and gets us good outcomes all around. The challenge too, in a broader sense for us in the school system and everywhere really, is the growing number of people identified as having an autism spectrum disorder. Now, we know that that is increasing. The identification of people on the autism spectrum is increasing all over the world. It's not just in the youngest age groups. There's good research coming out of the UK which shows that about the same proportion, around 1.5, 1.6% of the population is also being identified in the adult population. We know in Queensland, for example, in Queensland state schools, that there are over 2%, I think it's 2.3% of students have a verified diagnosis of an autism spectrum disorder. So it's not a rare condition any longer. It certainly was considered to be one, but it's not now really rare. And the numbers that we're seeing in schools do mean that every teacher is likely to have one child or maybe more in their classes each year. We haven't got time tonight to go into all the reasons behind that increase in prevalence, but I think there are some key pertinent facts that are useful to remember. We've seen a decrease in the number of children identified with intellectual disability, which suggests that children are now being identified with autism as well as intellectual disability. You can obviously have both of those conditions. And we are seeing, of course, a greater awareness of autism everywhere. In the media, I mean, it's almost every successful drama or program has a character with autism in it these days, it seems to me. So it's very much the flavour of the month, if you like. I think we're seeing an increasing fascination with some of the particular skills and abilities that people with autism have. And of course, there's been the rise of the internet, the rise of IT in general, which is a very natural home for a lot of people on the autism spectrum. So, it's almost cool to be a geek, and many geeks are very spectrumy. So for those reasons, I think, we don't have any evidence that there's any external cause of the increase. There have been various hypotheses have been made about vaccinations, about environmental toxins, none of which have been proven to be causal factors in autism. So what happens in school for students on the spectrum? You can't see probably what's written underneath those on that graph, but this is from the Australian Bureau of Statistics from 2012, and it's showing the particular difficulties that have been identified by people filling in the census for students with autism in schools. The biggest issue there, the tallest bar, is problems fitting in socially, followed by learning difficulties and communication difficulties. So for students on the spectrum, these are the sorts of problems that they're going to be having at school. And the sorts of problems that mean that for many students, school is a highly challenging place. So when we think about why that happens, why these difficulties occur, it's useful to look at some of the key characteristics of autism that are presenting challenges for students in schools. Having said that, before we look at them in a bit more detail, I would like to reinforce, though, the point that autism is a highly variable condition. So we do have a lot of variability within each of the domains that are affected by autism. So within communication and social, within sensory issues, within thinking and learning issues. We know, for example, executive functioning can be different in autism. So we get a lot of variability between people with autism in each of those domains. And in one person with autism, we will see differences as well. So you will come across, a student, for example, who has, very huge difficulties with communication and very, very poor receptive language. They may have a greater or lesser extent of sensory involvement, and we'll have another student who is highly verbal, never stops talking, and doesn't appear to have any sensory or very few sensory issues at all. So we can get a lot of variability between, but also a lot of variability within. So we can have somebody who has less of a communication impairment, more sensory issues, etc. And that can also change over time, and does change over time. So we see developmental changes occurring as you would expect in any child, any student, any young person. But we also see an uneven rate of development in autism, which can make it a very confusing picture sometimes, where we see children who, for example, appear to plateau or even regress in their skill development. This is particularly obvious or particularly evident we think about 25 to 30% of very young children with autism who actually appear to plateau or regress in the development of social communication skills around the age of 2.5, between 2.5 and 3. They eventually start up again, but we don't know. The research is a little bit conflicted about whether they eventually catch up with their autistic peers or not. But there certainly is, for example, a subtype like that. We also know that over time, adolescence can present particular challenges for students on the spectrum. Adolescence is a very confusing time for everybody, I think. So it's even more confusing when you have, extreme difficulty navigating the social world, adolescence as a result can be extremely stressful and extremely difficult. And also, too, we have the emergence, unfortunately, of comorbid mental health problems that are associated with some of those difficulties, particularly in the anxiety and depression area. So, having said all of that, thinking about what makes school particularly challenging for students on the autism spectrum, we'd have to highlight, first of all, that difficulty understanding other people and poor functional communication. Keeping in mind that students with autism may have quite good formal language skills, be quite competent expressively in particular, but have very great difficulty following all the sort of social cues that are associated with communication. So they may be able to, deliver a 10-minute dissertation on the alignment of planets, but not know what is going on when somebody's expressing surprise, or even when somebody's so bored with the dissertation on planets that they've nodded off. Students with autism just tend not to, it's not that they willfully don't notice those things, it's just that they don't actually register. So, for example, if you're neurotypical people who don't have autism, for example, would know that you've bored someone. Okay, I mean, I can even tell from this distance that you're being very good listeners and you're nodding and, it's great, I'm getting a bit of feedback. If I was closer up to you, I would see, to varying degrees, because some of you, it might have been a long day and you are a bit tired and switched off, but the lens of your eye would be dilated or contracted to a certain degree. Right? So when we're really interested in what somebody's saying or we're interested in another person, the lens of our eye actually dilates. And that's what we read when we pick that up without even being aware that that's what's happening. Whereas somebody on the autism spectrum, and I've had this said to me, can tell you exactly how many micromillimeters the lens may be contracting or dilating, but they can't tell you what it means. It doesn't sort of mean anything. Whereas we see it, we don't even know why we know, but we know, oh, that person's really interested in me, I'll keep talking. So it does make school particularly challenging because, of navigating those things, both in relating to your peers and relating to the staff. It's very marked, for example, students with autism tend to have difficulty with any kind of irony or sarcasm. And you'd be surprised how often teachers use sarcasm in classrooms. A lovely example, we were integrating a little boy into his first year of school in a mainstream classroom, and I was distracting as teacher, actually talking to her, and the kids were running riot. They were just racing around, jumping up and down on the furniture, making a lot of noise. And she raised her voice above this hubbub, stopped talking to me for a bit, and called out, "Are we all sitting up like good little people?" And of course, the children immediately quietened down and took their seats and did all the things that they were supposed to, except for the little chap with autism, who's down the back, and his voice piped up, "No." She asked a question, he got the answer. So that is not unusual in people with autism. So difficulty with communication, particularly those aspects of communication, the sort of social aspects of communication. Different ways of communicating as a result. Sometimes people with autism have great difficulty communicating and will resort to various behaviours that are defined as a problem to get their message across because they don't have another way to do it. Particularly if students with autism have a degree of intellectual impairment as well. Motivation to communicate is really a key difference that emerges really early in life, and we do notice that with many children, probably most children with autism, they just don't get the same feel-good feeling from interacting and communicating with other people. So it's not, any of you who have observed a very small infant doing that, eye gaze thing, just backwards and forwards, mum looks away, child makes a gooing noise, mum looks back, big smile, child smiles. There's all that toing and froing that goes on absolutely ages before language sets in. That's what we tend not to see in infants with autism. That almost not wired to find human voices and human faces interesting in the same way that typical infants seem to be hardwired to do that. So that carries through as we progress through, into school. Children with autism don't get so much, they don't feel so positive about or get so much positive intrinsic feedback from relating to other people. In fact, they may find being in a group, especially if it's noisy and crowded, actually quite distressing and want to get out of there. We do see, when we talk about the hidden curriculum, it's a term I think coined originally by Brenda Smith-Miles, who's done some really interesting work in this area, but really drawing attention to the fact that in schools we do two things. We teach the academic curriculum and we also teach the hidden curriculum. So all the aspects of school life that are not the academic curriculum, basically, and that's where our students have particular difficulties. That's where they really come unstuck, and that's why it's a concern at the moment that we see this growing emphasis in both, in Queensland and in other states on only adapting and adjusting the academic curriculum. Whereas really what we need for these students is an individualised program that focuses, often the hidden curriculum is the hardest thing for them to do, not the academic curriculum. They might be going reasonably well in the classroom, but have huge difficulties in the recreation space. We do see too, because the world's a very confusing and bewildering place for students on the autism spectrum, we do see often a desire to maintain sameness and predictability. And I think all of us need a certain amount of routine, don't we, to function. If you woke up in the morning and you were in a completely strange place and everybody was speaking Russian, it would be very, very difficult and stressful for you. Well, for people with autism, they are even more needy of that sort of structure routine so that they can actually make sense of the world. And that's why we get that resistance to change quite often, and that great distress if things change, and that because they've lost their moorings. And of course we do have particular issues. Students with autism do have particular issues with the academic curriculum as well. And in particular some subject areas like English. I've worked with a number of young men who are actually really good at physics and computer science and stuff like that, but the English curriculum, I don't think that's exclusive to autism, but particularly the case for autism, what do you think the poet's feeling when he writes this? It's like, oh, I don't have a clue. It's really, really can be really, really challenging. I think words speak louder than pictures speak louder than words, and this is a painting by Tim Sharp, who's a young man with autism who has very significant autism. Anybody who's seen Tim there's been a range of documentaries about him, or you might have even met him, will know that he has definite challenges around communication but he has this great ability to draw. His mother Judy helps him negotiate he's actually become quite successful and quite internationally successful. He came up with a character, his superhero, called Laserbeak Man, and Laserbeak Man now has his own television series, and he's become quite famous. So life's pretty good for Tim, which is absolutely fantastic. But Tim has the most delightfully literal way of looking at the world. So this is Tim's interpretation of a barbecue. And you can see they're all lined up there with their numbers, waiting to get their sausage. So he has some fantastic, you might have also noticed on my opening slide, there was a picture of Laserbeak Man actually graduating from university. And Tim, we commissioned that painting as part of a much bigger painting that Tim did for us at the Autism Centre of Excellence, which we had at our opening, and he was guest of honour, which was fabulous. So we are very keen to see more people graduating from our program. Okay, so why do we need to find a better way for students with autism? Well, the quick sort of cook's tour that we've just had around the issues for these students, I think speak for themselves in terms of, we do need to find a better way of doing things for autism. We also know that the outcomes of the education system for students on the autism spectrum are particularly bad, particularly poor. So if you look at, for example, from the Australian Bureau of Statistics, we see that for employment, for people leaving school or continuing on in tertiary study, we've got a figure that's something like 84% for the typical population, 53% for people with disability, including autism, and 32% for people on the autism spectrum. Now that's poor by anybody's standards, and it's particularly poor when you consider that many of these students, in fact, the way autism is identified now, we know that at least 60% of people who are identified with an autism spectrum disorder have IQ in the typical range. So it's pretty poor that we have, unfortunately, cases of young people who have great skills and abilities, but who are often so crippled by anxiety disorders or who have such difficulty navigating the job application system or even universities are not easy for people on the spectrum. We have them basically sitting at home and not doing very much. So that's not a good outcome. That's what we want to change, because not just obviously for the people with autism and for their families, but also as a society, we're missing out on a huge chunk of ability and talent that we could be utilising. And this has been recognised at times in different parts of the world. I know for a fact, for example, that NASA was actively recruiting here in Australia people on the autism spectrum to work on their various programs. And they were taking them back to the States and providing them with some life coaching support so that they actually, you know, managed to get home and have a shower occasionally and get some sleep and not sleep under their desks and eat really badly. So make sure they had some food in their fridge and all that sort of thing, because their skills and abilities were so valued on the program. These are people that they weren't necessarily recruiting people with university degrees. So, what can we do apart from shipping everybody off to NASA, what can we do to improve things for students with autism? Well, if we look at the research, if we look at the research, we do find some indications, we do find some evidence of what makes schools work for students on the autism spectrum. So we know that they need an individualised program. We know that that program must be, you know, have the student obviously at the centre of it and reflect as much as possible the student's voice. We know that good programs are multidisciplinary because autism is a multidisciplinary condition, so we need input from a variety of people, from speech pathology, from occupational therapy possibly, from psychology, to help us develop those programs, and that is a big challenge for schools, which of course are strapped for resources so much. We know that good programs focus on strengths as well as needs. So good programs look at developing those significant skills and capacities that people with autism have. A colleague of mine has done his doctorate and is currently, we're working on another project to roll this out in schools and called a savant curriculum. So he's actually looking at systematic ways of extending the particular skills that many people on the autism spectrum have. And many of the strategies and the process that he's looking at doing come from the gifted education sector. So it's very similar, the need for a mentor, for example, and that kind of thing from the gifted education sector. We know that we need to be flexible, which is often a challenge in schools, but can make all the difference. And teachers sometimes say, oh, well, if I make an exception for him, all the other kids will want to do that. For example, wearing a cap in class because a student can't handle the fluoro lights. We know that flexibility makes it work, and we know that we also have to put in place programs to ensure that the other students in the school understand what the issues are for the students with autism, because otherwise they will get resentful. They will see it as unfavourable, unfair and unequitable treatment. But there are good programs out there that we can introduce across the whole school that will improve everybody's understanding of what's going on for the students with autism, because it's not obvious. It's not obvious in the same way that a hearing loss or a physical disability might be. So that's really important, that and flexibility, being able to be flexible. A lifespan approach we've touched on, and that really does involve thinking about an overall vision for the student with autism, working with the family, and ensuring that there's good collaborative work happening with that student right across the school years, so that there's continuity from one year to the next. It's often useful to have a key worker or a case worker, somebody who can coordinate that process. A functional approach to behaviour. All of you would be very familiar with technologies like PBL, PBS. All of those things work extremely well for students with autism. What we need to do is always look for the antecedent for a behaviour, look for the trigger, and look at ways that we can manage the environment to manage those antecedents and triggers, as well as working directly with the student. In terms of, I might have missed one, sorry. Some of the other things that we need to do from a systems point of view and a process point of view, I mentioned the hidden curriculum already, in terms of looking at at how we can provide support there. Provision of systematic instruction, so this is another process strategy, providing routine, structure, often showing that visually so that the student knows, remembering that for many, many students on the autism spectrum, even those who appear to have good language skills, understanding is often problematic. Understanding because there's so much of what we understand is not just the words, it's the way the words are said, it's the context that the words are said, all the things that students with autism find hard. But also too, we know that autism is often characterised by a processing delay, particularly in the auditory space. So it may take the student longer to process auditory information. And if they have issues with sound sensitivity, or distortions, that can make understanding what they hear even harder. People with autism also report to us that some people have difficulty concentrating on more than one stream of information at the same time. So, for example, a very able person with autism who's an internationally renowned scientist, Temple Grandin, actually finds it much easier to understand what you're saying if she doesn't have to look at you at the same time. So she prefers to stand next to people when she has a conversation. So provision of visuals can certainly help a person navigate through their world, and they will need those for as long as they need them. Sometimes people say to me, when can we phase the visuals out? I say, well, if somebody has a hearing aid, you're not talking about when you're going to phase the hearing aid out, do you? No. Or, so no, it's a case that people with autism, we all rely on visual supports actually quite a lot. We don't realise probably how much we do. And it's important that they are provided for people on the spectrum as long as they need them. I've talked about collaboration and family involvement, involving the family, and also supporting families. Because if the family collapses, then the child collapses. So that's also, I think, an important aspect of what we do. We've talked about the academic curriculum and the fact that we may need to adjust that and adjust assessment tasks. For example, many students with autism have difficulty with, I'm sorry, I'm going on a bit much, I'll speed up, have difficulty with handwriting. So, a useful adaptation can be the provision of a keyboard or so that they can actually type. Okay, now I'm just aware of the time, so I'm going to skip through to just talk to you about the model that we've been working on at Griffith University, which we've called Successful Schools for Students with Autism. So we have our student with autism there in the middle. I can't get the pointer to work, but you can see the person in the middle there, and their individual characteristics, which of course no one will be exactly the same as another student with autism. And then we have levels of support. So we've been looking at, there's a tendency, I think, to focus on the student and look at a program for the student, but we see that actually as the top of the triangle. We actually need to start at the bottom with supporting the system. Here we are. So the system needs to support schools, essentially, and that's what we're working now with the Queensland Department of Education on. And providing that support. Leadership is absolutely critical in schools. You don't need me to tell you that. And to get things working and happening for students with autism, principals need the support of the region because there are so many competing and even maybe conflicting priorities for schools and for school executive. So the region really needs to provide support and also recognise that some adaptations such as reduced class sizes, the provision of relevant professional development, provision of planning time for teachers, all of these things need to be provided, and that this needs to happen at best happen at a regional level. At a school level, as I mentioned, leadership is absolutely critical, and that's something that we found with the pilot studies that we've been running in the far north Queensland. And again, I don't think this is new or groundbreaking. I think we've known this all the time, but it's certainly proved to be the case in working with students with autism. So there are various strategies that we need to put in place at a school level, many of which we've touched on already, but in particular looking at the ways that we can make schools more autism friendly, providing the supports that the students need, and also managing environmental challenges for them. So if there's a very loud, echoey space, and such as this, and you're having a very loud, noisy assembly, allow for the fact that the student with autism might find that challenging, and allow them to sit down the back so they can leave if it gets too much for them, or provide them with some other strategy, as an example. At the student level, then we've also touched on individualised planning and the need for that, and I think we've probably covered most of the main aspects of individualised planning that are important. So we've got both the content and the process there. Okay, so just to finish off with a quotation from Jim Sinclair, well actually it's the second last thing, which I think brings us back to where we started with that idea of respect for people with autism and understanding the characteristics of autism. And Jim Sinclair, who you saw at the beginning, says that, for example, if you took away the autism from a person, you wouldn't have the same person left that you started with. So it is something that's intrinsic to people, it's something that we need to respect, and it's something that we need to, look at ways to accommodate within our system if we are to have these students succeeding. The very last one, I promise, is a quotation from Luke Jackson, who wrote a book called Freaks, Geeks and Asperger's, which is a few years old now, but it's still a delightful read, and really I think an excellent way to get an insider's perspective on what it's like to be autistic from the outside, from the inside. And he talks about school being very much, he talks about the square peg and the round hole, and how that's what his experience of school has been generally, but he said they're coming to a bit of a rapprochement, so we have now a rounded square trying to fit itself into a hole with sticky out bits, and that's sort of working okay. Now, but just before we have questions, I'll just very quickly mention the courses that we offer at Griffith University at the Autism Centre of Excellence. So it was delightful to see at least one student here tonight. And we have a graduate certificate. This is all online. I'm happy to answer any questions later on, and I bought some brochures just up here if you are interested. We have a graduate certificate that's technically 1 semester full-time, but most people do it over a year. I do 2 courses a semester, so it's 4 courses altogether. The courses are Introduction to Autism, Communication and Autism, Autism and Learning, so all the aspects of curriculum, and social, emotional, restricted behaviours, repetitive behaviours aspects of autism is the 4th subject. And then we have a Master of Autism Studies, so when you've done the grad certificate, you've really hooked on autism, you can keep going. That comprises some more coursework and a mini dissertation, a mini thesis. We now also have a Master's Research for those people who are really keen on a research trajectory. So if you finished your grad cert and you want to go on to a research Master's, you can do that too, and that involves a couple of papers on research topics, methodology and statistics and exciting things like that, but necessary, unfortunately, and a much bigger thesis. So I'll finish up there, and I'm sorry to have run over, but we did have a late start, so that's my excuse. Do people want to... We have a mic down here if there are any questions or comments or...
Hands up.
You're either all asleep or I did too good a job. No, we've got one down the back.
Hang on, I'll do the back first, I'll come back to you.
Hi, Jackie. My question is about purpose-designed inclusion classes. So what would you recommend, or what would be, how would you start to make that work well in terms of best practice? I'm thinking of grouping children with like needs or with needs around the autism spectrum area in a room with other children, but having an extra teacher who's trained in this area.
Yep. There are a variety of models which have been tried or are being tried in various places. One of which, for example, we pioneered very much in New South Wales, a satellite class model, which is where you have a actual class of children with autism. So 4 or 5, usually little boys, or big boys too. We do high school. And the goal of those classes is to transition those children into their local school. And usually there's no set requirement in terms of the length of time, but usually on average they transition out, and that's an actively supported process in 18 months. So that works quite well. I know what you're thinking about is grouping. I do think we need the specialist support for a lot of kids, and that may be best delivered by specialist staff in a small group within a classroom. It's really a question of looking. Some children won't need that. Some children will be able to be supported in a mainstream class with some support to the teacher. I do have a concern with the tendency that we have to equate inclusion support with teachers' aid hours. I think that's a major problem. Teachers' aid hours are probably just one support that you can offer, and I firmly believe that the teacher's aid should be allocated to the teacher and not to the child. But that's a topic for another night. So I think we need a range of options, and it very much depends on the individual school what's going to work best.
Jackie, I was just going to ask, is there a paper out on your successful school for students with autism? Is
Yes.
it a book?
That's a really good question. I am actually working on, at the moment, on a paper right now, because I'm presenting at APAC next week, which is the big autism conference, and we have done trials in a pilot project in Far North Queensland, and then a bigger rollout across the region in Far North Queensland, both of which have been written up, and there are reports which are very helpful, I think good reports. I'm not sure if the department is going to publish those, but we will be distilling them into a series of papers. And in fact, we've been discussing, and I think the way that we'll go with the bigger project, the regional project, is we will actually publish it as a monograph, like a little sort of a slim book, because it really contains in detail all of these strategies and all of these things. So it's a question of watch this space. If you keep an eye on the Griffith, the ACE website, there'll be information there. But I am very aware of the fact we need to get it out there, and we're also planning a series of papers, journal articles as well. But thanks, keep the pressure on, and we'll keep doing it. It's so easy to do a project and then you want to rush on to the next one, and you forget about dissemination and how important that is.